Hello there, kia ora. On May 1, more than 5,000 members of the Association of Salaried Medical Specialists are going to be walking off the job for 24 hours in response to what they see as unsatisfactory pay offers in negotiations from Te Whatu Ora. It's a decision that's going to impact just over 4,000 patients who are going to have planned treatment postponed. So, what's actually going on here? Well, negotiations have been going on for a while, and the offer that was last taken back to the union saw a general funding increase of between 1 and 1.5%, which is well below that 2.5% rate of inflation that we're all dealing with, which means a real world decrease in spending power, just like what happened to minimum wage earners. 87% of the union voted that offer down, and on Monday, last-minute negotiations happened again, which weren't even taken back to the union to look at because the negotiating team felt that this offer was worse than before. The latest offer did take on board some feedback from negotiations earlier, including higher starting salaries for junior doctors, but still had the same overall envelope of funding. And because most senior doctors are already in that top current earning tier that doctors go through, the pay rise on offer for them was less than 0.77%, and it didn't include any back pay. And that number of doctors is actually part of the whole mix of issues going on. We simply don't have enough doctors or nurses, and the pay rises wouldn't really entice new doctors and nurses. And it doesn't do much to entice doctors to head to regions really suffering from a lack of medical coverage. In fact, according to the union, the offer itself specifically mentioned only 4 regions, the ones that get the most media coverage, but ignores a number of other regions needing more medical staff. On average, our regions need another 12% more staff. In some areas, that's as high as 44%. Meanwhile, Te Whatu Ora framed this as an incentive to get in hard-to-recruit districts, which will assist in attracting and retaining doctors and nurses. There is, understandably, a lot of back and forwards going on with both parties, and that means a lot of spin as well. The Health Minister, Simeon Brown, that evangelical Christian who refuses to say if abortion is healthcare, well, he's trying to frame this as doctors being selfish. How dare they put patients at risk? While the doctors are pointing out that due to chronic staff shortages and severe underfunding of the health sector, the amount of procedures and specialist appointments that will be impacted are about the same as what are already cancelled due to those shortages in staffing and funding. They also want to reiterate that if you do have an appointment that hasn't been cancelled or postponed, please do show up for it. And at no point has anyone suggested that essential services like emergency care or life-preserving services are going to be removed as part of the strike. But the union has been putting out messaging that the services may be a bit stretched. So please ensure that if you are visiting an ED or need to look at help for urgent care, that it's for actual emergencies, and not just because of the lack of funding for primary health service providers and the increased costs in prescription medicine, which means that some people can't afford to access those primary health steps and use ED as an alternative. And all of the issues are exacerbated by a range of other things going on as well, from the installation of a commissioner to the reinstatement of the board, the outdated and regionally siloed IT systems that have needed a massive overhaul for years, but which was put on the back burner, to fund those company tax credits for tobacco companies, along with hiring freezes that they say aren't technically freezes, lower than inflation and population growth funding increases, massive layoffs throughout the sector, and even resources being stretched as part of the initial pandemic response, highlighting gaps in the systems. Hell, even media coverage that focuses on the dysfunction and concerns within the sector. These are all factors to what's currently happening and how the public perceive it. So what's going to happen on May the 1st? Well, there's going to be a reduction in medical staff in hospitals, and on May 2nd, Te Whatu Ora will be counting the cost of that action. They have sought a third-party remediation process, which may happen, or they may come back with a better offer. Either way, though, it shows just how much stress our health sector is under. There simply aren't enough staff to meet the needs of the population. The policies of the current government will increase the pressure on the sector, and the funds don't seem to be being made available to find ways to fill those gaps. Judith Collins did say about the increase in Defence Force spending that the money will be found because it needs to be found. But from those medical professionals striking on May the 1st, well, to them it seems like that outlook isn't being taken when it comes to the health sector. Hey, thanks for checking out today's video. Make sure you like, share, subscribe so you get more updates as we go along. We deal with these guys for the rest of the year.